too. Thank you. My name is Barry Keppert. I'm the director of the Public Health Department at the Metropolitan Area Planning Council. And I think many of you joining us have been thinking about the various ways that we're providing support and doing direct work for the response to the pandemic. Now we're in this very interesting, hopeful time, I think, where we think about what's available and what the vaccines make available to all of us. And I'm sure, likely, as you've seen, there's lots of efforts to think about how we communicate about the vaccines and the resources that are related to it. Today, though, we really wanted to highlight what's possible potentially for cities and towns, and for messaging and for kind of outreach that happens closer to the ground. As much as we have these broader messages that are available, I think we're very interested in what does it look like as we get really closer to the people that we want to be able to have access to the vaccine, and people who might have questions about the vaccine, so that we kind of connect with them too. So we really want to be able to highlight some great examples that are happening, focused essentially kind of both statewide and within kind of the Boston metro area, and then talk about a shared resource, because we don't have to go this alone in terms of what we're developing, the materials that we can use. So first off, we'll hear first about two really great examples of work that's happening close to the ground, close to people who really should be served by the vaccine. We know everybody should get it, but we know other people have had really experienced much more disproportionate burdens and impacts from COVID-19. So we're going to highlight two examples, and then we're going to come to a shared resource that we'd like to highlight to you all. And with credit again to the municipal leaders, people on the municipal side and the communications who have been leading these efforts. And we're hoping this can really be kind of a way to lift up your work, but also a way to kind of provide more resource to you. So I'm going to kick off first talking about one of these efforts that we want to highlight. We're joined today by Anastacia Salcedo. Before I introduce her directly, but I want to talk about the Massachusetts League of Community Health Centers. They represent and advocate the Commonwealth's 52 community health centers and over 1 million patients. This is a patient base that's primarily with lower incomes, and 60% are from communities of color or immigrant communities. This is also a population that, again, tends to have a disproportionate burden of health conditions, given the systems and given the environments essentially that we have in the Commonwealth too. So they're really kind of affected more by the pandemic than other populations have been. Anastacia is a public health writer, and her company, Salcedo Marks, specializes in working with underserved populations and multilingual communications. They developed and are running the League's COVID-19 vaccine community engagement campaign. Her company has worked on many other health and public health issues for both public and private clients, including during the 2000s, managing outreach for the Massachusetts Adult Immunization Program. The H1 pandemic campaign won a gold healthcare marketing campaign. She's also done work extensively with local public health departments. So I'm going to turn it over to Anastacia to talk a little bit about the League's efforts and really highlight the really interesting work that they're doing on the ground. Thank you, Anastacia.
Hi, thank you, Barry. Can everyone hear me well? Yeah, okay. Thank you for giving us this opportunity to share what we are doing. We're excited about that, and especially about partnering with cities and towns as much as we can. The League has gone, and as you know, has a primarily low-income population base with many members who are from communities of color and the various immigrant groups throughout the Commonwealth. And these are the communities that have really borne the brunt of the pandemic. So going into this, we wanted to take a little bit of a different approach, which is that even though these communities also tend to have higher rates of vaccine hesitancy, we wanted to make sure that we were having a respectful conversation around getting the vaccine, and to respect each patient's autonomy to make their own decision about it. So instead of telling patients, you should get vaccinated, our campaign has focused on developing support materials so that people can have respectful conversations. We have 3 different phases of the campaign, and they are roughly parallel to the Commonwealth's 3 phases of vaccine eligibility. So we started in January with focusing on health center staff themselves, because many of them come from the same communities that they serve, and many of them were also had some concerns about the vaccine. So in the first instance, we had the materials available for health center staff to use. And then over the next phase was to have health center staff talk with patients when they were engaging with them either on site or through telehealth. And then the final stage, we are hoping to spark conversations among the public themselves. And so we've been slowly migrating our materials from being more suited to health centers personnel to actually being patient facing. And that is actually an update that we just completed over the weekend. So these are now available on the Mass League website. And maybe now is a good time to put that up. The other thing is that's interesting is how we develop these materials. And they are customized by population. And we did this because we recognize that each of the communities has a different set of concerns around the vaccine, and that providing a huge laundry list of questions and concern was not helpful. So we developed this through a 3-part process. The first was to review 42 different studies of vaccine hesitancy in PubMed that addressed hesitancy in the populations in the patient base. And from them, we compiled a list of about a dozen or so common questions and concerns. We then circulated all these questions and concerns to the health centers, to community groups, and to experts, and asked them to review them, to put them in the appropriate orders for their communities, to indicate any questions or concerns that were probably not useful, and to add any questions and concerns. So in the end, we've ended up with 11 different lists of these questions and concerns. Also, to facilitate understanding, these are written at a very basic reading level, at 5th grade reading level, so that they are laid out with plenty of white space, etc. So we also have, to go along with this, some guides for having these respectful conversations. And so these are, if you open up the tips for talks there, what this does is to give some ideas for how to start off a conversation about vaccine hesitancy, and then to continue in a way that is productive so that people can talk about their concerns and ask their questions, but not judge them about that, to give them the information, and then to close the conversation just by wishing them luck with their decision, but not pushing one outcome or the other. So this is the first component, the educational component. We are now, as I said, in the 3rd update. This is patient facing, and we are hoping that that we can get these materials out to the general public so that they can have the conversations themselves. So we have, and I should also mention that these are 10 languages. We have English, Spanish, Brazilian Portuguese, Chinese, Haitian Creole, Vietnamese, Khmer, Cape Verdean Creole, Arabic, and Swahili. One thing I want to say about these is they are all in formats that can be used by you, and you do not need to, if any municipality is welcome to take them and use them for their own populations. You do not need to attribute them to the league. They are, there and to be used. So please consider that as a resource. So another phase of this is videos with providers from each community. We're just completing a Black provider video, and you can see some of the subjects in this. And this again is taking a very different approach. We don't have them in white lab coats. We have them in their street clothes. They're sitting down at a table, and we've asked them to talk as if they're talking to a friend or a family member. They recount some of the experiences of the pandemic, and they talk about what their patients say, and they make some recommendations. But again, it's not telling people what to do. And so this video will be up possibly even later today. When we'll also have short segments addressing some of the questions and concerns. And then we'll be creating a similar video in Spanish, and then very short videos for the other languages. The final stage, which I think also will be interesting for cities and towns, is going to be directed to the public. And for this, we are commissioning artworks from emerging artists from each of the communities in the patient population to create an artwork illustrating a theme after the pandemic. And so we are then creating very short videos with the artists talking about their experience of the pandemic, showing the artwork, and we will be running these on social media. And as a piece that supports that, we are going to be reaching out to some of the cities and towns that were hardest hit by the pandemic, and seeing if they are interested in running a showcase of student art illustrating the same theme and doing some promotion around that. So it may be that we are in contact with some of you.
Wonderful. Thank you so much, Anastacia, for that presentation and being so generous with these resources. I know they will definitely be of use to cities and towns and community organizations that are all kind of grappling with these similar issues. Do you just want to pause for a moment and see if anyone has any clarifying questions for Anastacia before we turn things over to our next presenters? And folks can either weigh in the chat or raise your hand. All right. We will have time for discussion later, but I do want to make sure we have enough time to turn things over to our next presenters. We have two speakers from the Cambridge Community Corps here with us today. This is an initiative out of the city of Cambridge and the Cambridge Public Health Department. So first we have Deena Wu. She is the Youth Wellness Coordinator at the Cambridge Public Health Department. She works at the health department. She's worked at the health department for 4 years, mainly working on projects related to youth substance use prevention. And when C3 formed, she became the administrative coordinator for the program. Before her time at the health department, she was a grad student in public health at UMass Amherst. We're also joined today by Richard Harding. He currently runs the Men of Color Health Initiative in the Cambridge Public Health Department and is a consultant to the job training program Cambridge Works. In this role, Richard has led the charge to bring health to the forefront of men of color, and while holding the systems of healthcare delivery, health insurance, and public health accountable for providing culturally competent, relevant, and accessible prevention and direct care. So with that, Deena and Richard, love to turn things over to you.
Thank you so much. I'll get us started. I'll give some background information on C3, and then I'll throw it over to Richard to talk about our vaccine outreach efforts. So our C3 Cambridge Community Corps program, it started basically from nothing. We pulled it together in a few weeks. And our program first started with members going out to parks around the city. They were a resource to park goers. They provided masks, sanitizer, and information. And they were also just a friendly face. The work evolved as our demands changed and as the data changed and evolved. And during the wintertime, they worked more on supporting us at flu clinics, supporting testing sites, and doing testing advocacy and outreach. And now we are doing our vaccine rollout and vaccine, outreach. That's the word I was looking for. So I'll throw it over to Richard now to talk about that.
Yeah, so thank you, Deena. So first of all, I want to thank the folks from MAPC for inviting us and having us for this important conversation. So as Deena stated earlier, due to the COVID-19 pandemic, we were forced to think differently about how we approached engaging community. And so, as she said, it literally came from nothing, where we were looking at the open spaces as the weather was starting to open up a bit and people were out in water plays and parks. And then we evolved one other place to the testing, ramping up the testing advocacy in the city of Cambridge. And then we went on to the vaccine advocacy and the stuff that we're doing now. What I would share with you is that one thing that we learned, and our colleague Nancy talked about this, is that we were going to have to begin to have the core in a position so that they were a trusted source, because basically testing, which was obviously little less controversial for most people, it began the core's advocacy in a real door-to-door, hand-to-hand, block-to-block way. So one of the things that we also did was we looked at influencing our resources and programmatic needs as it relates to deployment of the core by looking at the information that was relevant. So if we saw there was a certain block or a housing project or a neighborhood that was what we call hot on our map, a red hot map, where the positivity was high and either it was just high or there was a combination of high positivity and low testing frequency, we would deploy the core to go there with information around testing. I don't know if you know, but in Cambridge, we have right now 7 days a week for free testing in various parts of the city. And so that was our entree into the vaccine education and then ultimately the vaccine delivery. I'll talk a little bit about the vaccine delivery. We're using a similar system, although as you all know, the vaccine chain of supply is often disrupted and disjointed and very inconsistent. But when we can and when we're doing good, we basically get in advance the number of doses that we're going to have as it relates to the particular category group that is up for their turn. So in this case right now, we're doing congregate living situations, usually through the Cambridge Housing Authority. And we're going door to door in each and every one of those buildings, literally in a partnership with the Cambridge Fire. So we knock on your door today. We say, Anastacia, would you like to get the vaccine? If she should say yes, we have a Google sheet in which we put our information in. And the next day in the said period, the Cambridge Fire Department, in coordination with sometimes the Cambridge Public Health nurses, actually give her the shot in her apartment. And we move from that space to another senior building, another housing project. And we do this all across the city so that we can have the real live conversation and bring the service to the people in Cambridge. So one of the things that's very important is that through our testing advocacy that had happened months before, we were able to become, or the core was able to become, a trusted source. So now when they knock on your door, you see their blue coat, you know that they've been here before. I'd lastly just say that we also spend some time really educating as best we can. Our core, as you know, we have a range of skill sets. We have some people who are, say, last semester, seniors in high school, and then we have someone with a master's degree. So we try to pull them together once a week to inform them of all the different changes in the governor's advisory as well as the city's advisories. We do a whole data point, looking at Cambridge data, where there's spikes and where there's not. And then also just filling them in on any questions that they may have as it relates to the vaccine. As you know, in Cambridge, we started out with Moderna, then we had Johnson & Johnson, now we have Moderna. So this seesaw forces our core to be able to have to be able to understand what they're talking about when they're going door to door, so that when people are hesitant, at least they know it's a trusted source. So I would stop there. I would just lastly say that this is an important thing not to overlook, the whole issue of being a trusted source. If you already have people that are skeptical and you don't build that credibility early, people will put up a more defense than you might think. So that's kind of where we're at, and we're looking forward to hopefully doing our best to help everybody in the city of Cambridge get vaccinated if they want to.
That's great. Thank you both so much. I think it's really good to hear how quickly the city was able to stand up this effort, and just how you all have adopted to take this really nimble, targeted approach to getting the word out about the vaccine. So really appreciate you all sharing a little bit more about your process. Just want to pause and see if folks do have any questions. If not, we will have time for discussion, and I know I'm eager to dig into this a little bit more, but with that, I will go ahead and turn things over to my colleague, Elaine Zhang, to do a demo of a new shared communications hub that we have developed, hosting a number of resources related to vaccine communications. Elaine?
Thank you, Kasha. And I just wanted to, again, to take a moment to thank everyone for taking some time out of their lunch hour to join us today, just to learn a little bit more about some great local examples of vaccine communication efforts. So just to pivot a little bit, we wanted to share a resource that MAPC has created. Let me share my screen. Hopefully you all can see that. Perfect. So this is actually a SharePoint site that we created after hearing from multiple municipal partners that there really was a greater need to better coordinate and share resources around the COVID-19 vaccine, whether that be up-to-date information from the state or local resources that municipalities are using. So we created the SharePoint site as a way to sort of host essentially for these resources to be shared and downloaded. So guests of this site will have the ability to upload any local, state, or national COVID vaccine resources they are using, as well as download anything they might want to adopt for their own municipality. So I will do a quick overview of the site and then dive deeper into each section. So the site really is broken down into 3 main sections. First, you'll see this document section, which has sort of different tiers of information. This section is where you can actually upload any resources you are using locally that you would love to share with other municipalities, as well as download anything else that you see on there that you see fit for your municipality. Down here are some links to some local, state, and national COVID vaccine communication efforts. And after this presentation, we actually will definitely add the Mass League website as well. Great resource there. And then lastly, down here is a live update from Twitter, actually from the Mass Governor's Twitter account, and also the playlist for all of the COVID-19 press conferences that Governor Baker has given. And so just to dive a little bit deeper into each section, the documents section has some general information and how to folder. So for any new guests, we do encourage you to sort of read this document just to sort of provide an overview of the site and how to use it and sort of how to upload information. In this general information, there's an Excel sheet for anybody who is interested. They can add their contact information on there and sort of serve as a way to connect with other municipal staff who are engaging in this COVID-19 communication work, and sort of as a way to network as well. In this municipal COVID-19 webpage, Elise has done a great job of collecting and collating a bunch of municipal COVID-19 web pages. And this can actually serve as a resource for you if you're interested in potentially recreating something like this for your municipality, or just seeing how other municipalities are reporting their COVID-19 data or COVID vaccine communication. In these next 3 folders, this is sort of where you'll see the different tiers of information. So starting at a local level, Massachusetts, and then even a state national level. And I won't dive into each of them, but the last one is research and best practices. And here we've actually compiled a bunch of just emerging research as it relates to how to best communicate around the COVID-19 vaccine, and sort of best practices to actually continue to encourage residents to continue to adopt protective healthy behaviors. Because as we all know, even once you get vaccinated, we still need to encourage people to remain socially distanced, continue to wear a mask, and practice good hand hygiene. So moving down, we have the links to some existing resources. Here we have the Punto Urban Art Museum, which is actually part of the North Shore CDC. They recruited a bunch of local artists to create sort of a suite of communication products, from posters, stickers. I think they even have videos and songs on there that were created in a culturally resonant way to encourage residents to think about getting the vaccine or continuing to practice the protective behaviors. This link might be really interesting for a lot of you. This is actually a running inventory that Barry actually helps facilitate the Metro North calls on a weekly basis. The Metro North is a region within MAPC that we help facilitate the calls weekly, and these include multiple municipalities north of Boston, Chelsea, Everett, Malden, Medford, Melrose, Revere, Somerville, Winthrop, and even neighborhoods in East Boston. And in here, you'll find resources that have originated from the municipality, as well as several hospitals as well that really serve these communities. So you'll have resources created from both of those avenues. And then we also have links to the Massachusetts vaccine education outreach material, as well as CDC, and then MAPC's COVID-19 response page as well. And that's a little bit more broad, but does provide some up-to-date information around COVID-19 vaccine as well. And then lastly, the Twitter update section. For someone who's a little bit Twitter illiterate, I really liked that Elise added this. This just provides up-to-date tweets from the Mass Governor website or account. And then again, like I said, the playlist. So yeah, that is a high-level overview of the SharePoint site that we've created. If anybody is interested in being a member of this SharePoint site, we can post a link in the chat for you to submit your email, and we can definitely add you to the site. You will receive a sort of an automated message from my email, but from Outlook, asking you to sign in, whether you have an existing Outlook account that you use with work, or if you don't, you're just going to be asked to create a new account, and that's how you will be able to access the site. So yeah, I'll stop there, take any questions.
Great, thank you, Elaine. We are really eager to hear your feedback on this site. Both, is it something you'd be interested in joining, and what would make this most useful to you all in your efforts to get the word out about the vaccine? So please feel free to drop your comments in the chat or raise your hand, whichever you prefer. As folks are thinking, I do want to turn it over to Mark Dreesen, who had a question for our friends in Cambridge.
Yes, I did, Pastor, and thank you to Richard, or perhaps to Deena. I'm aware of the fact that he's somewhat involved in the state's effort to conduct clinics at senior subsidized housing. So I was very interested to hear about your sort of round robin process, Richard, getting into the public and subsidized housing buildings using firefighters to help deliver those vaccines. What I'm wondering is whether you have been limited to senior housing only, or whether you have been able to go into more general public or subsidized housing that is not age restricted. Because we know there are many seniors living in those buildings too. And then, of course, there's the general population, which is rapidly becoming eligible, or will rapidly become eligible. And yeah, I've been concerned that, that there might not be adequate outreach to that subsidized and public housing. And some of those folks would be hesitant, or might, due to various limitations or life circumstances, not be able to go out and get a vaccine somewhere else. So I wonder if you could just give me a few thoughts about that issue.
Hey, Mark, This is when I should have tried out for my part in Star Trek. Every other word you said was broken up, but I'm going to try to answer your question as best I can. And I didn't get the part, by the way. But if I'm correct, you're asking if we're limited to, for whatever reason, to the senior congregate housing, and is that a hindrance maybe in helping us to get the word in other places where we can't go to, but they're in the same community, something like that? Give or take? Am I close?
Yes. Can you hear me now?
Not really, but let me answer. So
I'm going to put it in the chat.
Yeah. So what happens is we are at the we are at the mercy of the supply chain for the vaccine. And in this case, in Cambridge, what's been happening is that the Cambridge Housing Authority, which is one of the biggest sort of housing authorities, they had petitioned whoever at the state gives out the dosage to be able to do folks that are fit the certain criteria of age and living condition within their controlled housing developments. Just as an example, we were in Jefferson Park yesterday, a couple of days ago. They have a high tower inside the park, yet they have many apartments, hundreds, if not thousands within the development. We only had enough dosage to offer the people in the high rise who are either of a certain age or disabled. Now, why is the issue of equity? And I spoke to this in my team meeting, is that the truth is that if someone were 23 and they lived with someone who was in that apartment for whatever reason, they would be eligible because they live in that building. But if you went just across the yard in the same housing project, housing development, someone wouldn't be eligible by virtue of the way the dosages are given out. So to answer your question in a short way, that no, we don't control it. They basically tell us the different places where we go, dictated by the dosages. And then also we, by and large, are already working because the testing is more universal where anybody can go. We have built up sort of our credibility with the testing outreach, but it is an issue of equity, quite frankly, in my opinion, that if Mark lives in the high rise, he can get it. But if Elaine lives just across, once you come out of Mark's apartment and just across the yard, she can't get it just simply because of the congregate living situation. And then lastly, many of these dosages that we're getting, it's almost like they're earmarked so that, for instance, the YWCA, which is a place where usually women who have a history of abuse in some ways, it's like a sheltered living situation for them. We were authorized to go in there, but there are other places that, we weren't. So it is inconsistent for sure, but we go where they tell us. We're like that type of army. They tell us literally, Mark, they'll tell us on Sunday night, we have dosage that we're going to put in people's arms on Wednesday, and between Monday and Tuesday, we go knock on every door with the information and we get them set up. And it's been a interesting interaction, because the truth is that some of these congregate living spaces aren't really set up to do the shots in the hallway with kind of fold-up chairs, but we make the best of it, and sometimes we use a community room. I would say that getting in touch with the Housing Authority and their liaison has been great for us, both on testing and on vaccines, but it is not fair in my estimation.
Thank you, Richard. And Mark did clarify his question in the chat regarding whether you plan to go around and eventually hold clinics in regular public and subsidized housing facilities that are not limited to seniors. So I think you did answer that, but just want to see if you or Deena want to expand upon that anymore.
I think basically we are, our tasks are dictated to us, and we just kind of go do it. It's my hope, though, obviously, that, and I think Nancy and Sam and our other folks that are with us would say that, yes, I mean, we want to have a full-on vaccination program that allows any adult or, whoever's eligible to get vaccinated when it's their turn, when we can deliver it. And, as you know, with the Johnson & Johnson, it being one shot, it's a little different. With the Moderna, there's also the follow-up that happens in between to make sure that people are getting their second dose when they're supposed to. So I have to give, in Cambridge, we call it the Cambridge Pandemic Collaborative, but that group has been working from day one, a year ago, on building up all of these systems and all of what's necessary to have a robust pandemic response is what I would say.
Yeah, and I promised I wasn't going to speak. I promised Richard and Deanna and Barry that I wouldn't talk, but my name is Nancy Porter. I'm over at the Cambridge Public Health Department. And the business of our vaccines has been, so right now, we're wrapping up our seniors, and we are now going into the different properties across the city that have folks that are eligible, but they don't live in a simple, just only a senior building. So we've been doing that. I mean, and I'm going to be honest, we're trying to get as many shots in arms as we can, any opportunity we can. We are now working on the homebound folks as well, trying to get that sorted out. It's a heavy lift, of course, because simply every single visit would take 45 minutes essentially at minimum, because we have to watch everybody. So, and also we have to vet it. The other piece is that, now that, Cambridge is a part of the Metro Regional, North Boston Collaborative, that means that's going to allow folks from Cambridge to access other sites, unfortunately. And I'm sure a lot of you have feelings about the way that our state government has rolled out the vaccination and the way that public health has been pushed out of the entire equation. Basically, we've been offshored and all the work that we've done has been for naught. So that is definitely a challenge for a lot of us. I think that psychologically, on top of everything else that we've been dealing with in this pandemic, that was really a kick in the stomach. It was simply, it felt like a vote of no confidence in us. And so we take that seriously, of course, like the rest of you. And so we're trying to do everything we can to prove to the state that we can do this better and we can do this right, because we know that we can. We've been doing it since the very beginning. And so we keep trying and we keep looking for new ways to do it. The challenge is, again, that the state is very much holding it on terms of who gets what and allocation. We've been cut out of vaccinating teachers, for example. They've made it abundantly clear that we will have no role in that, nor will we have roles of, vaccinating our essential workers. It's all being farmed off to the third-party vendors, CIC, which is running and staffing the sites, as well as, Fenway and Gillette. So, it is a challenge, but the most important thing right now, I suppose, is to just get everybody vaccinated. And that's it. And I just want to say to Deanna and Richard, these two have worked so hard this past year. I mean, we didn't know what we were doing. We got a policy order, make a core. And we're like, cool. And they did. And they just, they really took it and they made it something. And I got to tell you, I mean, it's an incredible program. And I strongly recommend that you all take advantage of asking them whatever you can and reaching out to them later, because I'm sure they would love to share more. So thank you for allowing me to speak.
Thank you so much, Nancy. I do want to elevate this one question in the chat as well from Jennifer McDonald. She asks, do you have any outreach or materials for those who are already on board to get the vaccine, but are facing a barrier in making an appointment, as in, aren't sure how to navigate the system, the clinic isn't local, there's a lack of technical proficiency, et cetera. So I asked that question of all of our panelists, including Elaine as well, if there's any resources that we may have on the SharePoint site.
I can kick it off. So one resource that I think MAPC sort of envisions coming down the line is that to actually highlight a grant funded program that we are currently engaging in right now, where we are actually working with a group of funded local artists to create culturally resonant COVID-19 communication materials. And some of the proposals that have moved forward actually is around the process of scheduling for COVID-19 vaccine scheduling. And the interesting part about that is that it comes from a very culturally resonant perspective. And so it might not be your traditional way of signing up for a COVID vaccine, where family members may actually have to rely on other family members to help them with scheduling a vaccine appointment. Or we heard that some artists are actually highlighting how they had to create email accounts for their family members to actually be able to sign up for the vaccine. So we definitely envision that material coming down later down the line, especially hopefully as it lines up as the eligibility opens up to the greater public in April.
Yeah, I would just speak for the Cambridge situation. What we're doing, as you know, we just talked about and Nancy described on the tail end. So ours is a little more hand-to-hand combat, I would say, that we use the building management to sign the people up right, you know, as they would if they were giving them, you know, we're coming for exterminating or we're coming for inspection. So they use their natural communication network within the building. And then we come in and do the more hands-on confirmation. So, you know, Mark could have signed up with the building management as he would have for some other service. We come knock on Mark's door. Hello, Mr. Drayson. Are you still interested in the shot? He says, yes, we confirm that. And then we clean up the list and we get it to our folks at Public Health, who then get it to the fire department, who will put the shots in the arm. So the next day, it looks like a sustained period, usually 4 or 5 hours. In a building, we start at the top and we knock all the doors that said yes and take them through the regimen. Do you have allergies? Which we already asked already. Can you wait 15 minutes? We give them the shot, we wait, and we go floor to floor to floor until we get to the end. So we may have, in a day, we may tell you that we'll be administering shots from, you know, 11 to 6 at night, and we'll get you in between there. So we do it a little different in that we use the building management, who already has usually a communication system within the building, and then we come in to reinforce that and get the shots in the arm, as well as getting the pertinent information to remind them about the second shot and how that they would get to that if in case it's the Moderna.
And to add to Richard, it's been interesting. I've noticed that as our time doing this outreach has gone on, fewer people have been interested in the shot because they've already gotten theirs or they have an appointment to get theirs. So not that, I mean, understanding that there are all these issues, it's been great to see that people are still able to work around it and find their way through.
Yeah, just one other quick thing. We also try to, we don't, to someone's point earlier, I think it was Anastacia, we don't want to be the vaccine police. We don't like no, let's be honest, but we don't press no. What we do though is we press the maybes. So if someone says, hey, not so sure, want more information, I'd like to, then we would double back and press them. But the people that say, get the hell away from my door, I don't want that, we kind of let them yell at us.
Yeah, I wanted to also jump in on the materials for people who are having logistical issues, and I can really only speak to, again, the health center populations, which, but because there are many who fall into the category of really not English proficient, this has really been a big obstacle because the system of setting up an appointment is really cumbersome for them. And so just, trying to make it a telephone appointment, trying to use the computerized system, and then the issues of access. So one thing, of course, that if a person is, receives care at a community health center, they should reach out to their health centers. There are community health workers who are available to help them through that process. That might include some people who are in the public housing situation.
Thank you, everyone. That was really helpful.
And thank you for the question, Jennifer. That was really helpful. I see, so I've asked in the chat, we'd really love for this to be a dialogue. We'd love to hear from others too, who are pursuing interesting partnerships between cities and towns and community organizations, or other efforts that are happening to help spread the word about the vaccine. So I'd love for others to chime in the chat and share a little bit more about other work that's happening on the ground. Christopher, thank you so much for sharing more about what's happening in Gloucester. I also just invite, if you'd like to unmute and just share a little bit more about what's happening where you are.
Hi, so I had the pleasure of working in the mayor's office previously as the first communications director, had a brief stint with the state and came back recently. So I was learning a lot myself of all the tools that have been sharpened up over the time frame that I've been away. But the most important takeaway from my lens is to make sure that you're meeting people where they live, which is something you're hearing in terms of making sure you're not just overwhelming people, but giving them kind of actionable items especially as a highlight. So we do a weekly update that we push out via a text notification service, our website using Civic Plus. And so, you know, you have all the ways, but I think the important thing is to try to offer people the latest news up top in a way that they can understand what has changed since the last time. People are confused about phases or vaccines. And so really trying to help highlight where you're hearing, you know, in my case, in the mayor's office, we hear a lot frequently about the feedback, but to incorporate that in a way that's not just the same static information or infographics, but to have a call to action or to highlight that as a higher order thing. So you'll see in the chat window there, I provided this past week's weekly. But yeah, it's been a process, and I think that's true for everyone. But showing the support that we all have behind the scenes and in front, and having calls like this are important to remind ourselves of how to best work together and remind us all what it's all about. So, but thank you.
Great. Thank you so much for weighing in and dropping that in the chat. Certainly a helpful resource that we could add to our SharePoint hub. One question that I had thought of in you know, hearing Elaine also remind me that vaccine eligibility is going to be expanding pretty significantly in the next month or so. So I'm curious from our panelists, are there anything that folks are planning in terms of adjusting communications protocols, new efforts underway? Anything you have planned once vaccine eligibility does open up pretty significantly in the next month or so? Oh, sorry, Anastacia, I think you're on mute.
Sorry about that. Yeah, I think one of course, you know, you have to balance that with vaccine availability. So this has always been, as we move along, you know, we have to kind of adjust how much outreach we do because there may not be vaccine available. But I think one of the things that we're looking at down the line is actually a situation that's maybe a little bit more akin to the seasonal flu season, where you have sufficient vaccine and you're really dealing now with the pockets of very hesitant people. So we're going to be thinking a little bit about that as we do our outreach to the general public as well.
Yeah, I would agree. I think that you know, we're in a situation where literally, and just today, as a matter of fact, you know, we have to wait until we know we have it. We ran into a little situation earlier where we were, you know, thinking we were going to have it and we didn't have it, and we had to kind of suspend it for a week. So to Anastasia's point, you know, we're gonna, when it opens up at a wider scale, I'm sure we're gonna have to regroup and think about how we can do it. I mean, the one thing about going into the buildings with a sort of defined population is that you can pick them out and do them in a strategic way. When you open this thing up, say April 15th, you know, we may need to use, you know, the high school or Harvard University. Like, we have to think through that a little more. But I do think it is important, at least with these more marginalized and less you know, populations, that we're bringing it to them. That's been a big deal. Like, you just have to stay in your apartment. We'll come to you. That's the biggest selling point that we've had thus far.
Great, thank you both. And I see Liz has dropped in some great resources from Randolph and what that community is doing to get the word out about the vaccine. Liz, is there anything that you'd like to add for the group about what Randolph is doing?
We're just trying our best to make sure we have everything in multiple languages, and we're keeping the website updated almost daily with all of the new information that's coming in. And I think that the Facebook Live update weekly with our town manager really helps people to understand the information, because it's kind of information overload. So he helps put it into perspective.
Great, thank you. I know social media has been a really, really powerful tool over the past year or so. I guess, unless folks have any other questions that they'd like to offer or other examples that they'd like to share, just one final question from me for our panelists. Just, do you have any advice that you would offer for cities and towns or community organizations that are looking to ramp up their efforts to get the word out about the vaccine?
I'll jump in with it. So we're one of the things that over the course of time that we've been working on these educational materials, and now we are into our third update, we've been slowly gathering feedback on, what questions and concerns are most important for which groups. And so we're in the initial stages of this, but we're kind of starting to build what I would describe as sort of hesitancy profiles for each of the groups in our patient populations. And so those can help to inform, understanding what the hesitancies are and, at a more granular level. And we're looking at sort of defining the domains as hesitancy around the COVID-19 vaccine, general vaccination hesitancy, trust issues, logistical issues, and personal situation issues. If you can kind of break it down and focus on what some of the majority of the concerns are, it may help you to devise an approach that is more tailored and more effective. So you might, for example, with the Black community, there's a lot of trust issues, and you need to work on sort of a long-term engagement around that. In other communities, you may have something that is a little easier to address. For example, you may have, there's a lot of just general lack of information about vaccines in some of the immigrant communities. We have in one of African and Cambodian, and in the Arabic speaking community we found. So you might want to just have sort of general education information about vaccination and vaccines to improve uptake in future, let's hope not pandemics, but for future issues around vaccination.
Yeah, I think that, similarly, the hesitancy comes from obviously the historical stuff. It's one of those things where, as much as we want to say Tuskegee was a long time ago, it was real, and there's just a skepticism around vaccines in general. I also think that the mixed messaging that sort of was dominated a couple of months before the vaccine was online, mainly through some particular person we won't name in Washington, and how the inconsistent message came down about, even the, Operation Warp Speed. I don't know any Black people that want to sign up for that as it relates to vaccines. And then I think they're also, when we're in the field, even just the switch from Moderna to Johnson & Johnson, just those little things where people are building themselves up for this Moderna thing that, they've done all the homework, and then they see, although it's very effective, the Johnson & Johnson, just the, are we being slighted here? Is there a game being played with communities of color? I think those were real things that added to the hesitancy. I often say to people, you don't want to let perfect be the enemy of good enough, meaning that, the Johnson & Johnson is a very effective vaccine as it relates to vaccines. And then, truth be told, some people, particularly lately, like the one-shot deal. So I think this does come down to personal choices. Some people that I know that were really gung-ho about it, it's because they had multiple things going on. Other people were like, I'm just going to sit back and wait. So we'll see. I think the next couple of months will be telling. That's what I'll say when we open it up. And then we're going to really see, because everybody will be able to get it, right? We'll be able to see, no one will be able to hide with, it's not my turn yet, because sometimes that not my turn is saying, I'm not ready to get it anyway, right? So I think the next couple of months we'll all be able to see, and I hope maybe we can reconvene and talk about what we're learning once we get to that space.
And something else I learned from C3 is just the messenger is very important. The messenger matters, and making sure you have messengers that look like you and can speak on their experience has been helpful in convincing or encouraging others to seriously consider getting the vaccine.
Great. Well, thank you all for being so generous with your time and imparting all of this knowledge and your experience on this group. To close this out, I'd like to turn us over to Rebecca Davis, our Deputy Director.
Thank you. And again, a thank you to everyone for being on the call, all of our panelists, as well as everyone that's joined us. For me, this really highlights the twin issues of access and communication and how we have to work on them both all together. I'm really hopeful that we can continue learning together. And I think there's a tremendous opportunity, particularly as we see more federal funding coming to the state and coming to cities and towns, to think about cities and towns kind of really building out this model and, you know, thinking long-term about our ability to create better public health infrastructure and more community health workers, more folks on the ground to help not just with vaccination, but all of the other, you know, important public health needs that we know that we have. So we are committed to continuing to build this resource. We really encourage all of you to share the information you have. We want it to be a living site where we can learn and share best practices. And, you know, Richard, I'm going to take you up on that offer. I hope that we can all reconvene in the future, you know, as we learn more, as we see things open up, and hopefully as maybe we can tackle some of these access issues as well, so that we can continue learning from one another. So thanks everyone for joining today.
Thank you.
John.
Thank you.
Thanks, Darren.
Thanks.
Take care.